So we are coming to our last talk, our keynote address by Dr. Shams Mohammed NOMAN, who is coming from Chittagong Eye Infirmary and Training Complex. And he heads the units of glaucoma and cataract. And he will take us through the advantage of collagen implant in trabeculectomy. Be tuned, we will have a question and answer session or little discussion at the end of his talk. Dr. NOMAN.
Honorable panelist and dear audience, it is my privilege to be here as an invited speaker at All India Ophthalmological Congress. And now I am talking over the surgical management of glaucoma. Collagen is an option. So I have no financial interest doing this. So I want to start with a case. Mr. X, 45 years, diagnosed case of right primary open-angle glaucoma with left vasculitis retinae. Vision in the right eye is 636 and in the left eye no perception of light. Intraocular pressure is very much increased in the both eye, 45 and 35, with 4 anti-glaucoma medications. I mean the highest medications. In the left eye is totally hazy, fundus cannot be seen. In the right eye it is an advanced cupping. So this is the picture of the right eye, where what is the only eye of the patient with a advanced cupping with advanced visual field defect. So what is the issues to be thought? We need the operation for the glaucoma, and this is an one-eyed patient. So we have to ensure the success. I should not take any risks for postoperative complications like hyphema, hypotony, and raised intraocular pressure and wipeout. He underwent trabeculectomy with collagen implantation, and at day 7, this is the condition of the bleb, and at day 30, this is the condition of the bleb. And that was a very good bleb, and patient eye was survived. So what are the options actually in the glaucoma? Why I did the collagen implantation in that case? We could do the trabeculectomy, but trabeculectomy is still the gold standard operation, no doubt. And the success rate is 70 to 80%. But it is reduced in the complicated cases, and we cannot take risk in case of where the one-eyed cases. And in postoperative complications, it is not very much uncommon, like hyphema, hypotony, inflammation, and it has a moderate expense. I think the less expensive operation among the glaucoma surgeries. Trabeculectomy with collagen implantation, the success rate is increased due to reduced postoperative complications. That is my experience. The total success rate is almost the same as the mitomycin C and 5-fluorouracil. What is the advantage is the tenting effect of collagen. It acts as an antifibrotic. The problem is it is quite expensive. So and that is a major problem in a Muslim countries, as it is made from the pork origin. There is a religious barrier doing this, and we have to take a lot of permissions from the patient and a lot of procedures we have to do. Valve implantation or tube implantation is another option in the complicated one, but it is a time consuming, recommended for the complicated glaucoma only. The postoperative complications should be taken in mind, like hypotony, hyphema, tube exposure, tube corneal touch, and sterile maintenance. And no doubt this is very much expensive, may not be available in each and every part of the subcontinent of this India. And one important portions what different tubes and valves and what should be used and what should be available, and this depends on the expense, depends on the availability, depends on the patient's condition. So I had an experience comparing between the trabeculectomy and collagen implantation. Total 60 eyes of 60 patients were included in this group. One is a study group, only trabeculectomy, and a control group, without implant. With implant, it is a study group, and without implant, it is control group. And we, in the study group, we use 6x1 millimeter collagen. It means the atelocollagen and aminoglycans combination. What is the result actually? Very interesting. Postoperative intraocular pressure in both groups was significantly lower than the preoperative level at the last follow-up. The number of postoperative medications is reduced in the both groups, but it is less needed of postoperative medications in the collagen group. And collagen group had statistically significant less complications were observed in this study. And in terms of intraocular pressure, both groups have a very good reduction of intraocular pressure. So no difference between the amount of reduction of intraocular pressure. 4 eyes from the control group and 1 eye from the study group developed hyphema. This is probably due to leaking of blood from the scleral flap angle to the anterior chamber. In the study group, probably this is less due to relative tight sealing due to pressure of the allogen over the flap. So there is a possibility of less leaking. Allogen didn't show any allergy, but biodegradation is slower than the mentioned period of 60 to 90 days. I even saw almost 1 year it was taken to be absorbed, the whole collagen. Postoperative complications like endophthalmitis was not found in this study. This is one of my case where one eye in the case did the trabeculectomy, mitomycin C, another eye trabeculectomy with collagen implant, and that was doing good still now. What is the problem of the MMC? Success rate is more, no problem. Long-term complications, some long-term complications like polycystic bleb sweating, bleb leak, overwhelming bleb, and scleral melting and hypotony. It is a good one, but we have to think of that complications also. And these are some pictures of like polycystic bleb and some choroidal flap fold in a hypotonic maculopathy. And one of my cases where the just see how the bleb leaks occurs from the polycystic bleb, and ultimately I had to do the bleb advancing suture and bleb compression suture to for this patient. What is the advantage of collagen? It guides the fibroblast to grow through the matrix spore, acts as an aqueous humor shunt, acts as an aqueous humor reservoir, and actually it guides the fibroblast in an alternative way, and it makes a tenting, and also it makes an aqueous humor reservoir. Ultimately, long-term effectiveness is more. So this is some steps of doing the collagen implantation. In case of triangular flap, we can place it just over the triangular flap, the apex of the triangular flap, and in case of quadrangular, we can make it more posterior. So shortcomings, they don't do any comparison with MMC. Now it is going on, and I will present it in the World Ophthalmic Congress. Sample size should be more, long-term follow-up is needed, did not include any complicated and secondary glaucomas in this study. So what is the things we should think about the patient? Expense, the success, vision and satisfaction. This is very much important. It is really a very much challenge to satisfy a patient. And residual vision should be maintained. So my message for this presentation, trabeculectomy with collagen does not show any significant advantage over the trabeculectomy alone in terms of intraocular pressure, but immediate postoperative complications are less with allogen implant. That indicates collagen's safety profile. No allergy to collagen is observed, no intraocular inflammation infection is noted. Collagen implantation is a better option, but may not be the best option in case of primary glaucomas. So we celebrate our World Glaucoma Week, 8 to 14 March. Thank you for the patient hearing.
Thank you, Dr. Shams NOMAN, for your wonderful lecture. Any questions from the audience? We can take questions now.